Thank you so much, everyone, for joining us. Myself, I'm Kathy Machuziak-Costa. I'm the Director of Compassionate Community Care, and we have Alex Schattenberg with us from
Executive Director of the Euthanasia Prevention Coalition. Nobody knows me, so.
So it's wonderful to have both of us and all of you today. So thank you for joining us. We are going to be sharing with you our patient advocacy, community advocacy program and training. And just like I mentioned, we have it printed for you. So if you need a copy that's sent to you in your mail, we can do that, or we can email it to you. And I'm also going to post it in the chat here. For anyone who has questions, please feel free to add them to the chat, or you can hold them and then we will answer them at the end, because traditionally we go through the program pretty quickly and then at the end we save some time for any types of questions or comments. And so with that, I would like to just say, Alex, if you can start the video, that'd be wonderful. Thank you so much.
Yeah. So I was trying to find a patient advocacy video, and when we're talking about the visiting program, there's excellent videos out of the UK, England, and most of the patient advocacy videos I find are American, which sort of makes sense because they have a pay for healthcare system. Of course, it varies from state to state, so I did cut this one down by 30 seconds because I thought the first 30 seconds weren't very applicable to Canadians, but then I see we've got someone from Florida, so maybe I should have just played the whole thing and that would have been just fine and dandy. But on we go. And it's 2.5 minutes talking about being a patient advocate.
Managing all of this on your own is almost impossible. That's where a patient advocate comes in. The Institute for Healthcare Improvement defines an advocate as a supporter, believer, sponsor, promoter, campaigner, backer, or spokesperson. Patient advocacy came about in healthcare due to the increase in patients being overwhelmed with navigating a convoluted, confusing healthcare system. The insurance and billing alone can be difficult to figure out, let alone treatments and choosing services. Patient advocacy has its origins from the early days of cancer treatment in the 1950s. Patients trying to make healthcare decisions and seeking access to care were in need of a guide to help sort through the many aspects of care. A patient advocate can be a family member, nurse, case manager, medical billing specialist, friend, attorney, social worker, chaplain, or layperson. Patient advocates can work for insurance companies, hospitals, and healthcare systems, foundations like the Patient Advocate Foundation, or be self-employed as a patient advocate. The role of a patient advocate can pertain to a variety of aspects of navigating the healthcare system. The advocate can coordinate care among the providers, the doctors, therapies, pharmacy, and insurance, to ensure everyone is working towards providing the consistent care the patient needs. There are several roles that a patient advocate can take on. They can represent the patient or family member and/or caregiver for the patient. They can assist with the financial aspects of patient care, and they can seek needed services for the patient. The advocate can also be a part of the treatment plan process for the patient by knowing the illness the patient is dealing with, the standard of care treatments, and then assisting the patient in making the best choice for them. And finally, the advocate can help with all of the ancillary things that are often overlooked, like dealing with the activities of daily living, how to manage at home, cleaning, grocery shopping, being able to work, and negotiating all of the aspects of these for the patient. It is their goal to provide all of the support the patient may need, so they can get the best access and care for their disease process and focus on living, coping with their disease, and getting well if that is the goal. Thanks for watching and happy studying.
I don't know if that was ideal for our purposes, but it gave you some idea because we're more of a step-down approach as to what we're doing because we're trying to help individuals, right? We're dealing with individual people who we might know through our family, community, parishes, whatever it might be, and recognize the importance of advocating for those people.
Well, thank you, Alex, for sharing that. That's excellent. So tonight's program and training ultimately is a great opportunity for each of you. If you haven't taken any of our courses before and this is your first intro to us, please note that we're very happy to have you, and we'd love for you to share this program and training opportunity with others. So Alex and myself host these approximately every 2 months or so, and we will offer these free. So the guides are free, the training program is free, and we have this free interactive session that we introduce it to you. So at the Compassion Community Care, we take care of a number of different issues. If you're unfamiliar with us, I would love for you to check out our website. It's beingwith.org. And through that, we have educational resources. We have resources, for example, on elder abuse prevention. We've held a number of events that were very well attended and well received that give great solutions and effective ways to help people, especially those who are most vulnerable, persons with disabilities or the elderly, people who may be shut in, for example, to navigate certain situations and cases that may be quite difficult. Also, we have a helpline at Compassion Community Care where we receive calls 24 hours a day, 7 days a week. And through that, we provide advice, help, and support regarding euthanasia and assisted suicide prevention and or end-of-life treatment issues. So that's a confidential and free number. I'll post that in the chat as well. And by all means, please definitely check out our website. We have a lot of great resources, videos that we've done and trainings in the past too. And this is one of our great programs that we offer you the opportunity as a participant to actively learn how to be an advocate for others and the ways to advocate for others and what is the most effective means to advocate. So we'll jump right in. So why we visit? Ultimately, this is important because we see that when we're being with one another, we are creating communities. We are actually enabling a community to be surrounding an individual where they may not have had one. As you saw through COVID, especially, we did a study on this. This was very important because oftentimes we see that there was many that fell into despair, depression, maybe felt social isolation, were quite cut off from their loved ones, family, friends, other faith groups and communities. And so it's really important to call that back and to come back to one another, be interconnected and see what what needs are in the community. And oftentimes it's in our own families. We see this, right? We see this in our own circles. Oftentimes, if you go to a certain place, you find that there's people that are isolated in the hospitals, long-term care facilities. My family, we have young children, 4 young children under 5 and under. And so we visited a seniors independent residence locally here in Peel, and we visit there every month now with our children, and it's a wonderful opportunity and activity. So if I can do it, anyone can do it, right? And the kids love it and the adults love it, and it's just a wonderful time for everyone. And sometimes we are asked to stay behind and actually go to a person's home, visit with them individually, and that's a lot of fun too because the kids take over and I have to rein them in and have fun. But ultimately it is very nice because people get to have a lot of time spent speaking with one another and ultimately to be able to share. And when those opportunities arise, people will open up to you. And so what these trainings offer you is a chance to empower you. And so we're encouraging you here to gain the skills and confidence to be an advocate in the system, and especially in the healthcare system, because oftentimes people don't know how to navigate certain questions, situations, diagnoses. And that's why this healthcare and the helpline, is so important, because we get calls all the time from people who say, oh, I have this diagnosis or I have this situation, we don't know what to do. Well, sometimes there's ways that you can actually pause and reflect and actually ask for a second opinion or speak to someone in the family that has better suited towards that person's care and needs. And that is something we can help you and facilitate that as well. Why is it important to be an advocate? Well, ultimately, you'll see that advocacy is quite personal. People need advocates for various reasons, and it is something that is becoming more and more needed and necessary. So as we see and we walk through these various slides, you'll see this. Advocacy can bring up many topics. There can be issues around, issues around, for example, care, could be isolation, feelings of depression, people feeling, helpless, or, they're not able to get the treatments that they need. And so you as an advocate are a secondary person, a person who's come into the situation with that individual's needs in mind. And you are able to then better suit that translation to the healthcare team. So it's very important, this type of discussion that happens, it's very important because ultimately it goes from the patient-centered to the community of people who are surrounding them with the healthcare team and the treatment options that they're given, and just being there as an eye and ear for them to rely on for support. Advocating for yourself and others is an important skill. It's necessary to inform others about your needs, abilities, and wishes. And this is really important because some people can't advocate for themselves even, right? Oftentimes we walk into a doctor's appointment or whatever it is, the treatment option that we're looking at, and it's speaking to a specialist and we forget things. So it's nice and important to have a community, a person, a single individual. If I walk into an appointment alone versus with my spouse, I see that the treatment is very different, right? And I would see by a show of hands, when you experience the same thing, you've gone into an appointment with, say, your parent or a loved one, it's quite different than if you were to just walk in on your own. And so advocating is a skill that can be learned and results in empowerment ultimately. And what it does is it shows that there's a community around that individual. They're not alone. They're not facing this head on by themselves, and there's no one else that supports them. It shows that someone is actually represented in the community and cared for. And so one of the reasons why we've offered this and why it's so important is that as time goes on, this program was built out of our Being With My Story visitors training program. And so if you participate in that program that was last week, it was held over 2 nights. And what happens there is we show how it's important to be connected with one another and to help them, an individual, resolve certain issues if there are any issues, situations, life that can happen, and also take out those feelings of, depression or despair that has happened as we see so often with people who can become socially isolated. But what ultimately can happen when you do that type of visiting is that you find that you need to expand on it and advocate for them as well. And that some people prefer to have an advocate versus just being alone. And why is the case? Because you can be their voice, you can be also a friend, so you participate in those important interactions and meetings with them. And so it's important to the individual that they know that they have someone in their corner. And also through this process, you're making a difference. So this is really key here. If you are an advocate, let's say, and you're located in, let's say we have a client that actually just spoke up to us and said they needed an advocate in Peterborough. So if you happen to be in Peterborough, and you've graduated from our Being With Visitors training and you've done this as well, that's a great asset now you have that you can actually go out in the community and meet with that person too. So what is an advocate? As an advocate, you talk to the person. And what's beautiful about this is that you support them, you can act or speak on their behalf according to their instructions. And an advocate empowers their client by helping them to understand the systems that affect their lives. They help them access the care they need, and they make intelligent, informed decisions regarding their goals. How can you help? Well, you're helping that individual by standing up for his or her rights. And every person is individual. So we're going to get into this a little bit more in detail afterwards. But ultimately, each person has various needs that they have. And so you're going to be able to have that chance to find out, they're going to disclose what those needs are and see if you're even the right candidate to be an advocate for that individual. You'll also help the person to obtain and maintain opportunities to have meaningful involvement within their community. Because sometimes people want to go out, they want to do certain things, and they don't know what options they have or which access to services exists for them. So this is great because you're going to help them to gain that access to the supports and the disability-related services that he or she may require to have a good life. You'll also be able to speak to their healthcare providers with them and help them advocate for their needs. What is an advocate not? It's a person who does what you're doing is you're not providing counseling, you're not making decisions for another person, and you're not providing medication or providing any type of case management. And this is important. Why? Because we're not medical professionals. We're not here to try to pretend like we're medical professionals, because if that's your background, that's your background, but this is not why you're here. If you have qualification, that's wonderful. By all means, you can let that person know, but that's not why you're being brought into this role or this capacity. You're ultimately helping and assisting that person by advocating for them using the tools that you're going to be shared with tonight. And to be a good advocate, we ultimately want to see that people who can advocate for others are often very good communicators. They're able to have a good ability to, a good strong sense of how they can speak effectively and communicate, be heard and understood, and oftentimes clarified, not taking things personally, being able to kind of, shut out the distractions and the underlying feelings or innotations and what they think assumptions may be, but just simply get to the point of what's necessary and be effective at communicating that through the emotions oftentimes too. What else you would be a person who can ask questions. So we want to encourage you that you can ask questions, and these are important. Sometimes questions, probing in through questions is actually very important, and the way you ask questions is very important as well. You're also a good listener. That means you can handle information and you don't have to necessarily, respond right away. And you can take in information, account for things, and make sure you have detailed accounts of what was spoken and what was given and information shared. You're also a courteous and a respectful individual, which means, you're not going to be overbearing. You're not going to be speaking over other people. You're not going to be taking the helm at various interactions with doctors and other people and medical professionals. No, you're actually going to be more of a second person sitting in on an appointment and maybe listening on a meeting or a call, for example, maybe a Zoom meeting, and just being courteous, respectful, always being attentive to the person and their needs, but also be respectful of all the individuals and players in that meeting. Also, you can be also assertive and persistent. So if something is not being brought up or something is being neglected, you're going to be a person who can actually bring that forward in an effective way, okay, at the right time. You also want to ensure that you respect the privacy and making sure that any type of interaction that's confidential, any type of information that's being shared is kept only for your information only, no one else. This is completely, we have to underscore this, stress this, is that this is completely confidential information that is going to be shared with you if you become an advocate for anyone. And it's important to keep that in mind always. You also want to ensure that you know how important this information is. And so, of course, with knowledge is power, but you also have the capacity to, relay that information when it's important to that individual, for the patient, for their good and their needs. So sometimes you might be a reminder. You might just serve as a person to say, hey, by the way, Sandy, remember when you said you really found this was, important to you? Well, here it is again, just to remind you, this is something that you may want to consider. Identifying also or anticipating the client's unmet needs. Again, a person like yourself who's a good advocate wants to ensure that you are ensuring that you're covering all the bases. If a person has mentioned to you that something, X, Y, and Z is very important to them, you want to highlight those needs, especially if those needs are not being met. So with the next few slides, we'll have Alex join us.
First of all, I'm glad you have joined us, and a couple points I'm just going to reiterate, and that is advocacy is not for everybody, because it requires you to be someone who's going to be, and I think the most important section of being an advocate is that you're courteous and respectful at all times, meaning that you're a help to that person, but at the same time, you're also assertive and persistent. Now, why am I saying that? Because you're not going to be able to help the person unless you have that assertive nature. You're willing to talk, you're willing to do that and speak up for someone, but at the same time, you are very courteous and respectful. So anyway, I'm going to move on. I just said that just because I thought, to me, that's central to the whole thing. So let's get legal. Now, to be an advocate, there are different types of advocates, obviously, and most of the people who've taken our patient advocacy program have done some advocacy for a family member, friend, etc., someone who they know, and so they've done this already, or they know they might have to do this, meaning they know their mother's getting quite elderly, that their mother might need some help with things, etc., or they have a neighbor or someone who they've known very well, and that person, they're already helping them out, so they've recognized the importance of advocacy, and they've joined our program to gain further skills. There are some people who have some more professional nature to it. We had a couple sessions ago, a physician joined us who had recently retired as a physician, and now he's become fairly active in his patient advocacy. And he contacted us telling us that being an advocate is totally different than being a physician on the other side of things, but he's enjoyed it a lot. But what I'm saying to you is, if you're going to be an advocate, you have to have the consent of the person. And in our handbook, we do have an advocacy agreement. So that's very important. It's important that the person who you're advocating for, and if it's going to be a legal situation, so it's not just your mother and you're going in to help your mother or something like that, you're actually going in to help someone who's, let's say, someone you're not related to. It could very well be a neighbor in this case, but you have a legal agreement, so the physician's not wondering, who is this person coming in with, Mrs. So-and-so. So that's there in the handbook, and it's very important that we recognize this. So we're doing this, that there's a relationship, we're creating a legal relationship. Sometimes it doesn't need to be a legal relationship, as I say, if it's the case of your mother, father, maybe even very close friend or family member. But the fact of it is that a doctor will say you have no right to be there unless, of course, you have sign that advocacy agreement. And and when you have an advocacy agreement that's been signed and you're going to advocate for somebody, make sure the physician or the nurse practitioner knows this ahead of time, because the fact of it is you can't be going in to visit and then sort of surprise them that, oh, look who's here. It's Kathy Matusiak that's come with us. There she is. They should know ahead of time. They should be well aware ahead of time. Important things to know to be an advocate. Yeah, that was the contract I mentioned. You need consent. So important things to know. An advocate is a person. Here can we go to the next page? Because I've mentioned the contract already. Okay. An advocate. An advocate is a person who supports or promotes that, the interests of the other person. So you're not representing yourself, you're only representing the other person. And if you've taken the visitor training program, you've seen the little section we have on that. And it's very important to recognize that that on your own, you carry no legal authority. You're someone who's helping somebody else. And in the sense that they agree to have you there, that gives you some role, but you're actually representing a certain person. They are the person you're representing. An advocate does not interfere or intercede with the judgment of the person you're representing. You are helping them out receive the care they need. Earlier, Kathy made a comment that, when you're looking at these issues, if you're going to advocate for someone, obviously speaking, you hope, or it might not work out at all, that person shares the same values that you have. Because if they don't share your values, probably doesn't work out very well. You probably will have to say, I can't advocate for you. A healthcare proxy is different than an advocate. So a healthcare proxy, just like as an example, I just published an article today. I don't know how many of you get the emails from Euthanasia Prevention Coalition, but if you did, you'd see I published an article about somebody who's upset because they were the caregiver for their parent. And now the sibling was the power of attorney, though. And now the parent is considered incompetent and in the hospital, and it's the sibling who's making the medical decisions. And the person who was caring for the parent is upset about these decisions, but they have no legal power. So that's a healthcare proxy. That's someone who has the right to make decisions for you when you become incompetent. That's totally different than an advocate. A healthcare proxy is where you assign the rights to somebody, sometimes a family member. You should only have a healthcare proxy or advocate, an agent, power of attorney who shares your values. You shouldn't have, you should not appoint your oldest daughter or oldest son to be a power of attorney for you if they do not share your values. But that's different than an advocate. An advocate advocates for you while you are competent, right? They're with you, they help you. You might be having some questions about competency, meaning someone might be experiencing some dementia and things like that, but you're helping them receive the care that they need. Whereas a healthcare proxy only comes into place when that person becomes incompetent, and then you gain the power. And how the law works is that with a healthcare proxy or power of attorney, the person is deemed as if they are making decisions in the same way as you would make decisions, right? And that's very important. The other thing is an agent. So you have the situation of an agent is someone who's the client is given legal authority to conduct business on your behalf. So you have financial powers and you've got healthcare power of attorney. These are different things. The healthcare power of attorney goes into place when someone becomes incompetent and they make decisions for you. In the case of a financial power of attorney, they're making medical decisions. Financial decisions for you. Now, I'm concerned about this issue. Just so you know, I've got some experience in quite a few of these areas, just because, I get a lot of phone calls. Like I've dealt with a lot of people over the years, and I become concerned. Like if you have an elderly mother, for instance, who's still competent, I don't think it's right to sign over her power of attorney for finances over to somebody unless she's making serious errors, serious issues, because you're giving power away. You're making them become dependent on the other person. And if they are competent, they should still hold that power. And then the issue of a guardian. A guardian, once again, is a different question. Again, a guardian is a person who has been appointed by a judge to take care of that incompetent person. So, in the case of someone who never had, let's say, a healthcare power of attorney, who never signed a power of attorney for personal care document, giving someone that right to make decisions for them if they became incompetent, sometimes a judge would have to then, or like in Ontario, we have this Consent and Capacity Board. We have the Consent to Treatment Act. And so sometimes a guardian would be appointed to make decisions for that person, whether they be financial or healthcare decisions, etc. But you see how these are all different things, and that's quite important. So we can move on to that. But always remember that if you are an advocate, you are not authorized to make decisions for the other person, right? You're helping that person receive the care that they need. You're only there to represent their wishes. That's why it's important that you have these communications with this person. You speak to the person before you go to a doctor's appointment or something. You speak to them. And I'm going to quickly go through the code of conduct, and then we're going to go back to Kathy. The code of conduct for an advocate is I will practice with compassion and respect for the person with whom I work. My primary commitment is to promote the health, safety, and rights of the person, not yourself, of course, the person. I'll be transparent in my work with the person. I will maintain privacy on behalf of the person and keep confidential all activities and records. Now, here's the thing. Remember, everything you're doing with that person is their business. You're an advocate, so you're not actually, it's not about you, it's about them. Everything is their private information. We move on. I will guide and assist the person in medical decision making, but at no time will I make decisions about the health or medical care or medical services on their behalf. I might advise them. I will respect the person's values and belief system as the foundation of their decision making. I might not be an advocate for certain people because of that. We move on. And the code of conduct. Being an effective advocate means upholding the highest highest ethics and standards of practice, to practice with compassion and respect for your client and their family, to promote the health, safety, and rights of your client, to foster the autonomy of the person, to be transparent, to maintain privacy on behalf of your client and keep confidential activity. I think we're actually repeating this. I think this slide is a second. To guide and assist your client in medical decision making, but at no time make decisions about and to promote use of the client, to promote use of your client's values and belief system as the foundation of your decision making. So here's the whole thing. With an advocate, you're representing that person, you're taking care of that person's needs, you're helping that person receive the care they need, but you are not in any way imposing yourself upon them. You might be advising them, and we move on. To practice within your competency. Now, if you're just a volunteer and you're a friend, your competency might be very limited, and that's fine. But if you were, let's say, a physician, a retired physician or a retired nurse, your competency would be much greater. Any requests for services outside your expertise should be referred to someone who is equipped to provide those services. This is an important point because there might be services that are available to somebody, and you might have help with that to be able to find those services for them. But you should refer to people as much as possible who have the competency. You're not to accept money or gifts. There's a good reason for this. You don't want to be accused of coming into someone's home and taking their things. The reason is that because you're a caring person and trying to help someone doesn't mean that the oldest son realizes who you are. They may not know you. They may just be wondering. Now, we've also been told, as I say, by a woman from a Native community who took our training a few months ago, that if somebody in the Native community were to offer you a gift and you're to refuse it, they don't want to see you again. They're part of their culture is, you accept gifts free. You accept these things and you give gifts and you accept gifts freely, and it's just from the caring heart. So obviously speaking, when we're saying this, we're talking about a culture where you're concerned about not being accused of something. To fulfill requests to perform, you do not fulfill requests to perform illegal acts. Okay, you're not to develop a romantic relationship with your client. No, never. Not to agree to perform any duties without the disclosure or input needed from the client. So you're not to make decisions on their behalf. You make decisions with them. You're not to discriminate due to a person's age, race, religion, culture, or ethnic background, gender, sexual orientation, or immigration status, and to continue your further knowledge-based skill set in order to provide client with the best care they need. Now, it depends on what your role is. Like our role is a step back role. We're here trying to help people. We recognize that there's a lot of older people in our communities who really could use an advocate. We recognize when someone is in their, let's say, later 80s, or they have healthcare issues, or they have, I would say, multiple comorbidities, that they are seen differently by the healthcare providers if they have somebody in their life with them. So we're offering a lower type of role. That doesn't mean that there's not somebody on this training who's not a nurse or have a nursing background or have a physician's background, etc., or a social worker background, etc. We move on. I'll let you take over the Residence Bill of Rights.
Thanks, Alex. Okay, so with the Residence Bill of Rights, this is wonderful excerpts that we've taken from this actual document. It's a legal document, and it is available to you online. Here's this link that you can go to, and I can send this to you as well if you like as a follow-up. But it's taken from the Long-Term Care Homes Act in 2007. It's part 2, and this is ultimately what it summarizes, is that each person who is a resident of a care home, long-term care facility, has rights, and this is declared, and it is official, and it's legal, and it's binding. So if a care staff of that person is, a medical professional or anyone who's involved with their personal support or care, violates any of these tenets of the act, they could be held responsible, they could be disciplined, and they could be potentially even, fired or whatever other due process is involved. So it's important to keep these in mind. I wasn't aware of these until we formulated this training and before that when it was being done. But this is very important, and I think it's important for you to all know this as well. A resident in the document means a person who's admitted to and who is living in a long-term care home. So that's just to define what that means. And in terms of what the rights include, they include to be treated with courtesy and respect in a way that fully recognizes the resident's individuality and respects their dignity. They are free to be protected and from any abuse, not to be neglected by the licensees or the staff, to be properly sheltered, fed, clothed, groomed, and cared for in a manner consistent with his or her needs. So this is an important point. During our recent series on elder abuse prevention, we came across some information which was evidenced by some of our speakers that in certain homes and long-term care facilities during COVID especially, and even before that, there were instances where people's needs were not being met, even on a very basic level, for example, like their bedding and their sheets being changed. And this is potentially grounds for abuse and definitely is a neglect. And so as you may come across this sometimes in your own meetings or in your own situations with your family or close to, friends or relatives. Sometimes this is an issue where they say that they're being a center is being understaffed, or there's stress on the individuals, or there's certain resources that are not being fulfilled or not necessarily available. Well, this is something that needs to be, definitely it needs to be made aware of. So if there's an consistent issue, an error on the part of the licensees or the staff involved, then this needs to be addressed. And this is important. So for each of you to know this, you can take action, and you can definitely bring this matter to someone's awareness, especially the staff, the administrators, and the people who are managing them ultimately. And this is important because a person requires those things. These are basic necessities. Cleanliness, showers, having bathing needs being met. There was also instances where we heard of individuals sharing that during and even before COVID, certain senior homes had mold that was growing on the inside of their bathrooms and even in their own residences, in their rooms where there was humidity. So those are very, those are horrid conditions, to be honest, and conditions that could give rise to other infections and other diseases potentially. So needed to be addressed, absolutely, and needed to be made aware of. So those are some things to keep in mind. To live in a safe and clean environment, to exercise the rights of a citizen. So just as you are a citizen, in any other home and every other private residence, you have those rights as a person who lives in a long-term care facility. You also have an individual, a resident has the right to be told who is responsible for and who's providing the resident's direct care. So oftentimes we see that there is a circulation of staff and, there's different shifts and, there's things that are changed. Well, you have a right to call on the chart and know who was dealing with that resident at this time or that hour and who dealt with this situation. Because the way, for example, they handle a situation, dressing a wound or not addressing a wound, taking action if the person has, a symptom that's not being alleviated or responded to, that needs to be addressed. And that person sometimes needs to be also spoken to if this is a continuous problem, for example. Every resident has the right also to be afforded privacy in treatment and in caring for his or her personal needs. So if there's a discussion that's being made or had in an environment that's open, that is, for example, not private or confidential for that resident, then that needs to change. And they can't be made embarrassed, for example, or they can't be mocked in a certain way by sharing their personal information in front of others as well. And that's just basic, decency and human rights and standards. They have a right to have his or her participation in decision-making respected. So if a person is routinely being avoided, or for example, if a doctor is being asked to speak to the patient and they're avoiding them or neglecting that conversation, that needs to be addressed and made aware of as well and responded to. To keep also and display personal possessions, pictures, furnishings in his or her room, subject to safety requirements and the rights of other residents. And this is something we found because just right after one of our trainings, or you could say our seminars on elder abuse prevention, right afterwards, we found that someone called us and said that one of their close friends had an issue where someone was taking items from their room, and that there was money that was stolen, and that they weren't sure what to do, and they're worried for their safety because they didn't want to alarm anyone and create problems for themselves. So this is something very important. It comes around often. We hear stories like this, and it's important to know what your rights are and how to respond effectively, and we can assist you with that as well. Every resident has the right to participate fully in the development, implementation, review, and revision of his or her plan of care. Oftentimes you'll see there's quarterly reviews, or, annual, or, biannual, depending on the frequency, but you have that opportunity. And it's very important to be on top of those meetings because they can involve various players, various sections of care, from physio to, just various types of specialties. And it's important to have that in mind when you're speaking across the teams and you're speaking across to the different situations in that care of that person. Also, they have a right to give or refuse consent to any treatment, care, or services for which their consent is required by law, and to be informed of the consequences of giving or refusing their consent. So again, if they have a treatment that's being proposed to them and they don't necessarily want to take that treatment, they have the option not to, and they can, respectfully decline that as well. So it's important to be made aware of that too, that they don't have to take every treatment that's given to them if they don't agree with it, or if they think that there's something else that they can do. They also have the right to participate fully in making any decision concerning any aspect of their care, including any decision concerning their admission, discharge, or transfer to or from a long-term care home, and to obtain an independent opinion regarding any of those matters. And again, this is another thing that came up just recently. We had a person who said that they want to relocate to another care home in a different district area. And so this is something that there are services that are able to help to prepare a person to change, to move, to look at their options. And so we can also share that with you. And that's actually on our website now under our blog posts and also on our social media pages. And a resident also has the right to have their personal information within the meaning of the Personal Health Information Protection Act kept confidential in accordance with the Act, and to have access to their records of personal health information, including their plan of care, in accordance with that Act. So you always have that access, and that person should be able to access that information if they are being requested. Every resident has the opportunity and the right to receive care and assistance towards independence based on a restorative care philosophy to maximize the independence to the greatest extent possible. So if we know, for example, an individual is made aware of a care or treatment option that is going to reduce their independence, and they do not feel that that is something they want to partake in, they have every right to not do that. Obviously, keeping their health in mind and all of that. So it's important to keep these points in mind too, because they have various options for themselves and from their care team. They have the right to not be restrained or confined except in the limited circumstances provided for under this Act and subject to the requirements provided for under this Act. Now, if you've taken our visitors training that Alex and I did last week, this came up too because we don't believe in restraints. There's very limited, very specific instances where that may be it may be necessary, but this is not something that we ever really we can condone, because this is something that will obviously create a factor in a very resistant. It's just a nature of restraints, right? It will create restraints, and it'll effectively conform a person without their will and their consent. So there's very limited opportunities that these should be used and chances for it to be used. But again, if this is being used and there isn't, there are cases of this that people are being restrained, more so now we find that the opposite is happening, that people are being restrained by using morphine. So they're medically being restrained or confined or made complacent to, undergo certain, situations, for example, bathing, or changing, things like that. So the person doesn't feel like they can really respond effectively. And this has, become made aware to us through the Elder Abuse Prevention series that we hosted. And those series, by the way, are available online, and you can review those anytime. To communicate, the person also has the right to communicate in confidence, receive visitors of his or her choice, and consult in private with any person without interference. And this is important too, because this came up during the recent last 3 years, especially. People who are dying or very ill have the right to have family and friends present 24 hours a day. And that's in the Bill of Rights. They also have the right to designate a person to receive information concerning any transfer or any hospitalization of the resident, and to have that person receive that information immediately. So if you designated an individual to receive information on your, status, then that information transfer needs to happen immediately if that person is transferred or there's hospitalization to any move of the resident. And that's important to keep in mind, because sometimes we find this, that a person or resident is being transferred with as little as 24 hours notice. And we received a call about this actually not too long ago. And so we had to intervene on that as well, and to respond and advocate for that family. And it's important to keep this in mind too, what your rights are, and for your loved ones as well and friends. Every resident also has the right to raise concerns or recommend changes in policies and services on behalf of themselves or for others to the following persons and organizations without interference and without fear of coercion, discrimination, or reprisal, whether directed at the resident or anyone else. So there's various levels. You have the residence council, the family council, the licensee. If the licensee is a corporation, then it could be the directors and officers of the corporation, a member of the committee of the management team for the home, or the board of management for the home. They have also this to the staff members, government officials, and any other person inside or outside the long-term care home. Every resident has the right to form friendships and relationships and to participate in the life of the long-term care home. So if people are being, told not to communicate to one another, or being cut off from each other, or certain programs are not accessible to a resident for whatever reason, then those need to be reevaluated and actually brought to concern. Every resident has the right to have his or her lifestyle and choices respected, and to participate in the residence council, to meet privately with his or her spouse or another person in a room that assures privacy, to share a room with another resident according to their mutual wishes if appropriate accommodation is available, or to pursue social, cultural, religious, spiritual, or other interests to develop his or her potential, and to be given reasonable assistance by the licensee to pursue these interests and to develop his or her potential. Every resident also has the right to be informed in writing of any law, rule, or policy affecting services provided to the resident, and of the procedures for initiating complaints. So for example, if there is an issue or there's been a violation of any of these rights, then they have the right to due process and affect any changes that need to be made, and to initiate a complaint. They have the right to manage his or her own financial affairs unless the resident lacks the legal capacity to do so. And again, like Alex mentioned, there's various other protocols that are available to a person if they don't have a financial or care manager for their advocacy, or, for example, their well-being. They have the right to be given access to protected outdoor areas in order to enjoy outdoor activity unless the physical setting makes this impossible. And they have the right to have a friend, family member, or other person of importance to the resident attend any meeting with a licensee or the staff of the home. And so this is important. I'll let Alex take away from advocacy and effective advocacy. Thank you, Alex.
Effective advocacy. Well, this is what we're trying to do. To whatever degree we become an advocate, whether it's for a family member or a friend, or we develop a whole professional nature to what we're doing, wider, such as more involved with a wider physician, patient, nursing type advocacy role. The fact of it is we want to be effective advocates. And, the idea is that we recognize that people feel vulnerable and powerless at times in their life. We also recognize clearly that a lot of people are in a situation where they don't know what to do, or they have a hard time being able to advocate for themselves. So, you don't want to risk angering people. And you recognize that some people have these sort of difficulties in their lives and being able to deal with these things, but especially if you're a long-term care resident. I can tell you it's interesting because when my mother-in-law was in a long-term care residency, she passed away a few years ago. There was one nurse there who, for whatever reason, didn't seem to treat her well, and so didn't she didn't want to talk about it. Certain things happened with their relationship, and she didn't want to comment on it. But she sort of mentioned something to my wife as we were visiting, and Susan started asking her more questions, and she sort of talked about certain things that had happened and everything, and she was bothered by. And so, because her mother wasn't willing to, she was actually afraid of dealing with it because she thought, there'd be a reprisal against her. Therefore, my wife contacted the administration at the home, and it was dealt with. And in fact, my mother-in-law never saw the lady again. So it's not, I don't know what happened to the lady. It's possible it was a big home, so it's possible she was just shifted to another part of the place. It's possible they said thank you very much. I don't know, but I just know that my mother-in-law never saw that lady again because my wife expressed it clearly that there seems to be a real problem here. But as an advocate, you're helping people through these stressful situations, and you recognize people can get into these stressful situations where they don't know how to react to it, or they feel they can't react to it because they will have some sort of reprisal or effect upon them. We move on. We're looking at positive solutions to problems. This is what we're doing. And the biggest thing about this is, when you're trying to communicate first, you're recognizing that you're speaking to the person, you identify their concerns, you're trying to help them achieve what they need. If someone's living in their home, for instance, and let's say their abilities are lessening over time, they're having different health concerns, they're having difficulties accomplishing tasks that they used to do, etc. And they really could use someone coming in to their home and giving them some help. An advocate can make a big difference for that. So how do we help? Well, we're protecting someone that we're caring for by, we're listening to them, we're finding out what they need, we're representing them, we're urging them through organizations, etc., to the doctor, etc., saying to the doctor, well, I think she can use some care a few hours a week. I think she can use this and that, and making this aware to them that we're making a difference in their lives. So we're positive and we're constructive in their life. And we move on. So how can you help? Well, the first thing is to be present. You be present in someone's life, you get to know them, you help them. If it's a family member, well, obviously then you make sure you're the one to be present. You find out what's going on. You create empowering solutions. So let's say someone's having difficulties with being able to, and then they're still in their home as an example, and they're having difficulties being able to, do health, I would say make healthy meals for themselves. That maybe you get involved with helping them order the meals on wheels that come once a day or a couple of times a week. You be aware of the options. So you may not know of options, but then you're going to have to contact people, find out what the options are. And community choices, obtain assistance through the helpline from Kabasha Community Care. But there's different options in different situations. We talk about the importance of advocacy also because, as I say, a doctor or nurse practitioner is often the gateway to the service. They're the person who's in control of saying yes or no. If they agree with you, yes, so and so could use some help, you're more likely to get it because the doctor or nurse practitioner has advocated for that and you've helped them get that. So what's the best communication tips? Well, I think a lot of this is pretty basic, but I think we should emphasize the fact that you should always be polite. The fact of it is you hear people saying that, we get calls like this all the time. Kathy's dealt with several recently like this, where someone's having a difficulty being able to achieve the best results for a family member. And you realize that they have a personality type where maybe they're a bit pushy and less polite than they should be. Okay. And it's not that there's a problem being a bit pushy, because sometimes you have to be a bit pushy, but you have to be very polite. You're dealing with healthcare people who will take it personally and who will say, I don't need to take this, and who will say, you're not coming around anymore. We're borrowing you from the hospital or borrowing you from the care place. They will do that. It will happen. So you must always be polite. Be clear about your position and the organization you represent. So if, let's say, you are representing the parish group you're the advocate, but you're a parish friend or you're a neighborhood friend. Be very clear about that. Be helpful. Be very helpful. Be patient but persistent. I think that's so important. I tell people you have to be so kind, so polite, so patient that sometimes it hurts, but you must be persistent. You must be capable of being persistent. The squeaky wheel gets the grease. I'll give you another example. My son, Peter, is autistic, and my wife is his, how would you say, advocate. Now he's a pretty smart guy and everything, but if it weren't for Susan, my wife, I don't know what he would be doing, because the fact of it is that she's the one who's always advocated for him. She's the one and she's got that sort of personality type, that she's persistent and she continues. Of course, she knows to be polite, etc. But she's the one that really helps out. Decide what you are trying to communicate. That's about communicating with the person you're advocating for. What do you want them to do? If you have been misunderstood, correct and rephrase. So try and make sure everything's very clear. If you do not know the answer, say so. Don't be saying something that you don't know. Be very clear about that. You only say what you know. If you do not understand a question, ask for clarification. Okay? Listen carefully to the question. Sometimes you're advocating for someone who might be a little bit older and they might have some hearing problems. They might be experiencing a little bit of dementia, meaning it's not abnormal for someone to start losing their memory as they're getting older. It's not. That's what happens to a lot of us. I have a hard time with names and I'm only 55, okay? Anyway, the point of it is that, you're the one listening carefully. You're the one representing and helping them. Make it very clear what you want them to do, okay? Speak slowly, okay? Speak slowly. Be very clear. We move on. Key active listening skills. Encourage. Yes, I think it is the best idea for us to do this. Yes, it would be helpful if you had this service for you. Inquire, find out what's available. Contact people, find out what are the options, name the emotion. Yeah, I can see how you must be frustrated. I can see how this would upset you. I understand that maybe you're feeling down about this. I understand these things. So but it's normal. Redirect questions. Reflect on these things. So if someone's saying something to you, reflect on it. Think about it. Rephrase something to make sure people understand. This is very active listening skills to rephrase something. Someone might say something to you. A lot of people jump a bit, and they shouldn't do that. They should say, "Did you mean this?" Or, "I heard you saying that. Is that what you meant?" Because it's important to do it that way, because there's a lot less frustration in that, and also you get a better clarification. Sometimes silence is the best way to handle things. Sometimes it's good not to talk. Sometimes it's good if someone makes some statement that you don't like or you don't agree with. There are times when you just better not to respond. Summarize, right? Summarize something, make it very clear, summarize it. Use the I statements. I heard that you said this. I heard that you said that. Did you, I think you mean this. So you're not being, how would you say, upsetting someone. You're not in their face. It doesn't feel like you're challenging them, but you are clarifying things, and validate everything. Validate the questions, validate what's going on. Make sure we know exactly what is meant by what's going on. We move on. When you disagree, and there are times when we disagree, obviously, and it's important to disagree and disagree well, acknowledge the impact, acknowledge the impact of the past, someone saying, I think this is the best way, or I've done this and that, and you don't agree. Okay. Acknowledge this, acknowledge it very, focus on the present. Focus on the present. Don't focus then on the thing you disagree with. Focus on the present. Focus on the problem. I understand what you're saying, but let's see if we can get help with you're having this back pain right now, and you're not sure where how this back pain started. You don't know what this means. So let's try and deal with the back pain issue. Do not generalize. No, don't generalize. Don't make things sound like it's something it's not. Don't generalize it. when we're talking about it, someone says, this and that, say, you're always like that. No, you're not always like that. Okay. You might be often like that, but you're not always like that, or, be very clear that we're not generalizing. We're talking about the specific situation. We're being very clear. We're communicating with you about this. Listen to somebody. Listen carefully. Sometimes someone needs you to listen, and we must do that. And always be kind and compassionate. You notice how this comes up over and over again. Always be kind and compassionate. Within the training, we've recognized, and this comes from the fact that you're talking on the phone to people over and over and over. All these different people you get calls about, and then medical treatment questions and communication issues with the physician, communicating with this nurse, communicating with this, and these calls are coming over and over again. And what do you learn over and over again? It really pays off to be kind and compassionate. Yes, you have to be assertive, no question about it, but you must be kind and compassionate at all times. And I say, even if it hurts, we move on. I think this is yours, Kathy.
Thank you, Alex. So I'll take over on the communicating with different personality types. This is a good kind of segue into my own family life, because I like to compare them to my children. I have 4 children currently, and we have 4 completely different personality types. So I have a daughter and 3 sons. My daughter's the oldest, and I'll give you a little bit of a reflection on each of them when we talk about the different personality types. So this is something that can be qualified as 4 distinct types of personalities, but they're actually part of all of us. So each of you will feel that you're, at certain time and place in a certain given situation, you could be the aggressor, the contemplator, the mediator, the socializer. But for the most part, we tend to see that there's certain generalized characteristics that come through with certain personality types that are more the one type than, for example, others. So it's nice to have an idea of what the different types are. And this is good to know for any communication, any type of situation that you may find yourself. But ultimately, just to keep this in mind, that it is kind of a general framework, but it's also something that can be very particular to the person that you're speaking to, or the type of person you're relating information to. Be there the care provider, could be the medical professional team, it could be a support person, or just the individual that you're actually advocating for. Okay, so this is a good overview for that. The first type is the aggressor, and this is a person who I like to kind of simplify and think of my son Mateusz, who's it's a short for Matthew, and he's 2 years old currently. Next week he'll be 3, going on to 7, right? He's pretty smart and he's quiet, but when he gets activated, as they say, he can become an aggressor. And usually they're more in a reflection type manner, but once again they're triggered, they will often ask the what questions. And the what questions are like, what's happening? What can we do? Where can we go? What's the action, right? What can we do next? What's the next step? Their biggest fear is losing control. So for example, if there's an immediate need and they can't find a solution, they're going to be, this will be an issue for them. And so they want to find something that they can control, something that can impact, they can act on, and ultimately that will bring about the best result, okay? And as quick usually as possible, or as effective as possible. These individuals are competitive, they're goal-oriented, they're demanding usually. Like my son, they like to get what they want immediately. And this is tendencies for anyone that's younger, but this can be for an older adult as well. They can be, for example, if it's a patient, they want, for example, to have immediate response to certain issues that are happening. And that's not always the case, right? As you know, with medical treatments or with care options, or even just day-to-day activities. So you just have to be the person who can handle this person, and I'll go through steps on how to do that next. They are often people who are blunt and they're direct in their communication and make quick decisions. So for example, they won't beat around the bush around things. My son, when he wants something, he'll tell you, "Mommy, why did you do that?" I don't want you doing that. They'll just be blunt, and you can't be offended. You just have to accept what they're feeling, because that's what they're feeling. So, and you respond, obviously. The tip for these types of people and how to relate to them is to be as factual and accurate as possible. And this makes perfect sense, because if they're relating to an information that they've received, or some type of unfortunate circumstance, and their first immediate reaction is, why did this happen? What made this happen? Then your immediate reaction should be factual, be honest, be worthy, and come back with accuracy and not exaggeration or anything like that, or generalization. You also don't want to exaggerate. So again, Mateusz, when he wants something, he'll say, I want more of this. He doesn't want that, then, I give him what he wants, or I don't get it, you don't give him anything. So it's just being straightforward, right? And you're asking challenging questions, and they'll ask those challenging questions oftentimes, but don't tiptoe around these individuals. They want a straight shooter. That's what you are. You're going to be that straight response. They also prefer that you use simple language that educates them about the situation. So whatever's happening around them, they want to know right simply, the easiest way, the simplicity of things is the beauty of things, right? I think Einstein said that. So we want to ensure that they keep things simple and understanding what it is. They enjoy having structured conversations with tasks and goals for making decisions and achieving objectives. So they like a plan, okay, a program. How are we going to accomplish this mission? When you're having conversations, they want it in a timely fashion. They don't want it to be rushed. They want you to stand your ground, and you should be strong and confident in response to this type of personality. You can also use indisputable I phrases or messages rather than the judgmental you messages. So instead of saying, you made me feel this way, Mateusz, I would say, I felt that you did not listen when you did what you just did, right? So just being very straightforward and using I instead of you. Remember that you do not have to agree with these individuals. They completely understand if you don't agree with them. You just have to be straightforward with them. And also keeping them active in the decision making. So if you're doing something, you're changing a plan, you're changing a projection or something that you think is going to happen, you want to keep them on the same page. So they're level, so they know exactly where you're moving because they're moving with you. You want to give them guides that they can follow and manage on their own. So if there's a plan in place, you can say, well, then once you start A, you can do B, and then you do C. And that way they can manage the situation because they're action people. They want to make sure that they're involved in the actual solution. Now, the next type of person is a person who I call Noah, who's my other son. He's my second oldest after my daughter, and he is the why. He's the contemplator. He's asking the most bizarre questions sometimes, and lately they're getting increasingly worrisome because he asks so many things. But anyways, he's 4, so that makes sense. He should be asking questions. They ask the why questions, and he's often asking questions, about existential matters, like, why are we here today? Why did we not go to Florida today? Like he loves Florida. So their biggest fear is criticism of their work or ideas. And this is interesting. Why? Because a contemplator has a lot of detail that they complete in their day-to-day tasks or in their ways that they do projects or they assemble things. They put a lot of thought and care, concern into their work. So their biggest fear is criticism. So if you actually criticize them right off the bat, you've lost them. So you don't want to lose that person. You keep them in without criticism. You make sure you're very polite. Again, like Alex says, be painfully polite. Sometimes it can be painfully, but you want to ensure that you're very polite, very kind, obviously very kind and compassionate, and especially of their work or their ideas, because these are very valuable, and you want to make sure the person feels that you appreciate that. These individuals are often meticulous, they're introverted, and they can be detail-oriented. They can be perfectionists. They're usually suspicious of others. So this is something to keep in mind. They may answer a question with a question, and I hear that a lot. And oftentimes in the workplace, these will be individuals usually that are, designers. They'll be the creative people. They'll be the ones who put together the beautiful presentations that you can't even compete with, right? They're the person who creates a nice image or diagram or something that will suit the needs in order to have a creative, face to the organization. And this is often someone who's in the background. They won't often be regarded or maybe, necessarily praised in that organization. So this is something that just to keep in mind. Contemplators are good problem solvers, and we just have to be very deliberate when we speak, especially because, they're oftentimes people who are very creative and not necessarily regarded for that. In terms of tips, we want to lay out problems in a detailed and orderly manner. So if there are any issues, just make sure you're keeping them detailed and it makes sense and it's precise. So the person has a train of thought that they can move along through your own ideas, or they know where they need to go. Be truthful, obviously, always be truthful. This is our main theme always with all of the different types of communication with various types. You want to be forthright in your conversations. So forthcoming. So speak to the problem, what the problem is, right? Giving breathing space before you expect a response. So oftentimes I get ahead of myself, but when I'm speaking to these types of personalities, I try to keep them involved. Hey, how do you feel about this? Is this something that you think is a good idea, right? Like keeping them engaged and also giving them an opportunity to speak and to think and to respond. Also, ask them what they are thinking and feeling. Same thing, right? And showing empathy when they share concerns and worries. This is important, very important, because you want to ultimately show that you care and that you appreciate them and their concerns and their worries. You want to try to also bring a big picture. So when you speak to a contemplator, if I'm speaking to my son Noah, who's 4, you want to bring a big picture view to the discussion. So we're not going to go to Florida today, but we might go to Florida in the next couple months. Right? So the big picture is that we'll go there sometime soon, just not immediately. You want to use humor. So I try to bring humor into a lot of these conversations because they're very heavy, oftentimes, these issues. So I think it's important to laugh sometimes about these things and to bring them out of themselves and their worries. And what's really nice about this is that you can bring up anything that's funny, right? Like even sadly, certain situations can be really hilarious because you have to laugh or else you'll cry. And then you also want to make sure you speak in a way that shows your appreciation and affirmation. And so again, I always appreciate individuals that are creative contemplator types because they appreciate that. They often don't get that kind of recognition because a lot of the work goes kind of for granted or, not necessarily recognized. So it's important to bring that up and to share with them how you appreciate them. The third personality type and communicator type is the mediator. This is who I call my daughter, and she's the oldest child I have. She's 5. And she'll often ask questions about how does this happen? So she's also our engineer. She's our future author, designer, everything. Like she wants to know how everything works. And their biggest fear is loss of stability. And oftentimes what we see is that if something seems off to a mediator, they feel that stability is going to be at risk. And so they get very concerned about the overall well-being of everyone and the situation. So they want to bring in everyone. They're often the person who has the minivan. Okay, so they have everybody come on board and let's go and do a group field trip or an activity, right? Or let's get everyone around the table and have a nice, tea or some kind of drink and plan something. These individuals are usually calm, they're level-headed, and they're great listeners. They like to contemplate questions. So for example, you may not get an answer immediately, but when you do get an answer, it'll actually be very usually profound or at least quite thought-provoking. They will dislike conflict, so they will internalize and tolerate it. And this often is a person who will get to a point where they can actually burst. And my daughter can do that too sometimes. And so we just have to be aware when that happens that she's reached her point, because even mediators can get that point as well. Mediators will try to keep everyone happy and often at the expense of their own happiness. And that's a sad point too, because we often ensure that everyone is happy and they can get overlooked sometimes. Some tips with handling a mediator is to show appreciation before difficult discussions. So I call this the sandwich approach or the hamburger. You start with the top bun and that's, hey, by the way, I love what you did yesterday. You made that card for, grandpa. This was really beautiful. By the way, and then you put in the middle part, which is the meat, but it's also the problem or difficult part. And you say something like, oh, but I really didn't like that you didn't clean up your room yesterday. So next time let's work on that part. And then you can make another card for daddy because he really liked the card you made for grandpa. So you see how you sandwich that? Positive, negative, positive. So something to keep in mind. But that's, you want to show them some positive before you bring in any type of negative discussion, and then follow it up with a positive note too. And then you definitely want to let them take charge of planning because planning is fun for them. They enjoy it. It's part of their gathering. They're resourceful people. They want to be creative. They want to engineer solutions, put them on the table and execute them. So you want to help them take the helm on things like facilitating a plan or effect and solution. They also want to put discussions on the calendar. So if there's an event, they like to plan putting things in place. So if there's an important meeting coming up for someone and they have a plan in action, they like that. Think, plan, and think some more will pretty much sum up the mediator. Some things they want to do is combine facts and feelings. They like to share how things made them feel and how they participated. And it's really nice for them to keep that in their heart. They internalize it and they share it with you. You also want to make sure you give them space to express their opinions before you give them your take on this situation, because by sharing first, they kind of can unload, and that way they get filled up when, they've had that kind of given away. They can share first and then they can take in after. And it's important to keep this balance because oftentimes they don't get to be heard oftentimes because they're the mediator. They have to hear everybody else's opinions. So when they can share their own, express their own, emotions and feelings, it's important for them. They also want to help avoid any criticism or nagging around these individuals because they want effective solutions that are going to work for everybody and they will create the most positive and best outcome for all. You also want to state the rules for the conversation at the outset. So for example, a person who's a mediator will not understand why everyone's gathering together if you haven't outlined their need to get together beforehand, right? So this is important. And take your time. You definitely want to ensure that you're taking your time and you don't necessarily have any issues delivering the messages. If there's important messages that need to be delivered, you make sure you address those first. Then the final type and personality is my youngest son, whose name is Tobias, and he's our youngest. We call him the office baby, and he's a socializer. Those are the people who ask the who questions, and their biggest fear is social rejection. These individuals are charismatic, enthusiastic, persuasive, talkative, and social. They're also visual and creative. They smile and they captivate the whole audience. They're the star in the room. Socializers do not keep track of time well. They enjoy being the center of attention. And so one thing is to keep in mind is, it can start with a compliment, and then you can gently redirect the conversation away from tangents. You can be spontaneous with them. You can start with the feelings part, but you also want to focus on the big picture. You want to save details for later. And also stay positive. Talk about what can go right in a situation. You'll work with them on plans, and you can be prepared to move on quickly. So we're going to take the next few slides to talk about advocacy at the doctor's office.
Yeah, so advocacy at the doctor's office is incredibly important because that's often the place where you're going to have the biggest effect for someone who you might also be a visitor with, because now you're someone who you're visiting with them. Now you've become an advocate with them, and now you're going to the doctor's office to make sure that they receive the care that they need. And similar to other cases, you need to make sure that the doctor, that the nurse practitioner knows ahead of time that you're coming. That's just the first thing. But anyway, you can help a person understand and navigate through the healthcare system. That's the primary thing you're doing. I think it's really important when you're dealing with someone who's a lot older or might have some significant health issues that, as we've said in the visiting training program, that you need to have that information ahead of time as to what their concerns are, because now you're representing them, you're helping them achieve the goals of care that they need. Just by being present, you can affect what is being said to whom and how well the information is understood. I always say by just being present, you're actually showing the healthcare providers that this person is important. They have a friend, they have a family member, they have somebody with them who acknowledges that they are important. It's often important to listen to all the questions and be supportive when the client feels anxious or confused. So when you're listening, you are helping them find out what's going on, but you're also noticing that the person you're helping may not be happy with what's being said, so you're going to help them clarify. So we move on. So what are you doing as an advocate? Well, you're helping the medical professional understand the complete health situation of your client. Now you're doing that by, of course, you're communicating with your client ahead of time. You're communicating with the family member or friend or the person you're advocating for ahead of time. And so you're helping them know exactly what the concern is. If there's the new healthcare problems, etc., that should be discussed. Here's what's going on. You keep track of the old and the new symptoms and problems with current treatments or significant changes to discuss with the doctor. This is important because the fact of it is that the doctor might not have any idea that there's something going on. They just know that they have an appointment with so-and-so, and it's good that you're helping that person express that. Some people have a hard time expressing that they have some concerns about new problems, etc., and you're helping them explain that, or you're representing with them. You're managing current medications. I think this is so important. Medications, supplements. The reason is there's so many people receive, not everyone. A lot of people today are receiving too many medications. Now, you probably noticed that, they've got their organizers and they've got the daily, amounts and here, it's all separated for them. Kathy's figuring out for her dad ahead of time to make sure he doesn't take too many one day and another. That's exactly it. And it's all in some big container. And you're looking at this thinking, are all those pills interacting properly or not? I don't know. I'm not a professional, but what I do know is they all have a different effect, and sometimes they don't go together as well as maybe they should. And maybe and we have to think about what happens. Someone goes to the doctor and they're having a health problem, and the doctor's saying, well, you seem to have this and that, we'll give you a prescription for this, right? And then they go back another time and they're having a different problem. The doctor's saying, well, you seem to be having a problem with this or that. I'll give you a prescription for this. But now you get the two going and on and on and on and on. Anyway, managing current medications is very important. Go together to the appointments and take notes. Now, remember the notes that you're taking, that's the person's privacy. You're only taking the notes to help the person. You're not taking notes so you can find out something about someone and have that information. And you're also going to bring up questions with the doctor, ensuring that critical details are not being overlooked, right? We move on. To be a healthcare advocate, you require written permission from your client. Well, we went to that first under the legal issue, and in our handbook, we do have, a specific sort of healthcare agreement that can be used. Something like that, or something very similar to that can be used. So you're making sure that if you're going to actually legally be an advocate, then in fact you have a signed agreement and you're in place. To be an advocate in the healthcare system, you require the written permission of your client. You don't have any right to be there unless it's agreed to that you can be there, right? Make sure you complete the patient agreement ahead of time, and then make sure they know that you're coming as the patient advocate. You make sure. So what do we do when we're arranging a consent? Because we're discussing with the person what the expectations are that he or she may have. Okay. So someone might have expectations that you can't fill. So that's good to know. But when you're discussing it back and forth, you can say, I'm happy to help you with A, B, and C. I'm happy to help you to make sure that your doctor's appointments, that you're receiving the information you have. I will look into a few issues for you to help you make sure that you get the care you need. Also, I'll check out your, I'll bring sure I have your medications with you and things like that. So the doctor knows the A, B, and C. You're negotiating because maybe you can do A, B, and C, but you're not comfortable with D, and that's fine. You ensure that you're willing and able and comfortable with doing the tasks before you agree to become their advocate. You might not be a fit for someone. To speak on behalf of another person, you must receive consent from that person. Now, we've already mentioned that. We'll mention it again. So written permission is necessary, okay? Once you both agree that you'll be the person's advocate, complete the patient advocate agreement, which is on page 49 of this document here. But it's also, if you do the the visitor training, it's in that book too. And we have it in the handbook guide also. So it's, it's easily accessible. If you can't find it, Kathy will email it to you. Before your client's appointment, ask them about how they've been feeling, what's bothering them, what's going on. Find out, so therefore you're able to help them express that before the doctor or nurse practitioner. You may get more information when they're relaxed. Say, let's have some tea and discuss things, relax, and then when they're in the office, someone might forget in the office. Someone might go in the office and they'll be talking about the problem they've had for a while, and they forget that they've got this other problem that they wanted to discuss. You're there to help them. Asking several times over a couple of weeks might help you collect more information. So you're visiting someone, you might say a couple of times, have you had any issues? Oh, yes, I've had this issue. You discuss it ahead of time. Make sure you have the information ahead of time. We move on. Patient advocate agreement. Well, as I say, it's in our booklets. Here's a copy of it here. You see it's quite clear. It's very easy to use. This is designed for Ontario, but if you're in Saskatchewan, you just cross out Ontario, or you can actually maybe we could send you one that would say Saskatchewan. It's not the issue of the province you're in per se. It's the fact that you have an agreement in place, you've discussed it, and it's been signed and it's dated. Okay, so it's a legal agreement, and we move on. Before you go, well, the time of the day is important. It's important. The person may be better able to participate in the doctor's office in the morning. So, if you're better in the morning, make sure that the appointment for the doctor is scheduled for the morning if possible. Or maybe they sleep in the morning, so afternoons are better. You and your client should be well informed about their healthcare needs, understand the condition, treatments, and use of terms that the doctor may use. So that's very important. So we've discussed these things ahead of time, and we move on. Review the following with your client. These points will help you maintain a positive, productive relationship with your client's medical providers. As an advocate, you and your client are partners. So the doctor should listen to your concerns and answer your concerns, and you should feel comfortable with talking to the doctor. The doctor should be sure that your client understands and feels comfortable with the decisions regarding their health, and it's their health. Now, remember, a lot of this is going to be because you notice that somebody is, they need an advocate. They have multiple health issues. They might be becoming very elderly and they're having a hard time in the system, okay? What is the person's concerns? What is their physical symptoms? What is, pain, shortness of breath? You discuss this ahead of time so it can be brought up with the doctor so the doctor knows or the nurse practitioner knows. Is the person seeking information about medication and side effects? It's possible someone received a new medication and now they're tired all the time. And so there's a side effect to that. And then you set up an appointment with the physician or the nurse practitioner to say, I'm having this side effect. I'm pretty sure it's this is the drug I'm receiving because beforehand I wasn't having this problem. It might not be the actual drug itself. It might be the interaction of two drugs that are causing this. Does the person want to report new symptoms or concerns? Generally discuss how to talk with a doctor about sensitive issues. Maybe the person doesn't want you there when you're talking about sensitive issues. It's good to know that because then at that time you would leave. He or she might prefer that you not talk to the doctor about certain things. That's correct. And sometimes just your presence is enough. Someone might say, well, I need you there because you're how would you say, my support blanket, but please, don't discuss things too much. Your presence is enough for me, okay? And for some people who love to talk, maybe that's not the best person to be advocating for. Find out if the person wants to have some time alone with the doctor. Good preparation is important. So you have meetings ahead of time with that person, drink some tea or some coffee, relax, discuss these things, find out what they need, because that's what you're doing. You're helping to represent them, and we move on. Okay, gathering information. What is a list of symptoms? It's important. There might be new symptoms. There might be new issues. List of prescriptions. So bring the list of medicines he or she uses, or put them in a bag and take them with you. Okay. And this would include herbal remedies or supplements or whatever, because they might also have some sort of reaction to something else. It's possible. Test results, gather information from the previous visits. Show make sure you have that for the doctor. The doctor probably has that anyway, but doctors deal with hundreds and hundreds and hundreds of patients, so sometimes having that with you is important. No drug allergies. If there's a drug allergy, make sure you know about that. We move on. Bring this information along with the list of questions and topics that you and your client want to discuss with the doctor. So you're helping your client. Have a notebook. Sometimes it's important that you know that you're going to be taking notes ahead of time, so you make sure they know. But sometimes this becomes an issue anyway. Sometimes it's okay to talk with your client ahead of time, as you know, and make sure they know what's going on. Record the date and time of every meeting of a telephone call. So if you're going to talk to them by telephone or meetings, record the time and the date. So you could say, we were talking last week. We know this is what happened. Record your discussions. Some people will actually record discussions with the recorder. That wouldn't be my style, probably. I would probably want to just take a few notes. I would take light notes. I'm not into heavy notes, but as long as I know exactly what's happening, that would be important to me. Write the speaker's name, title, or position. So if you're talking to a doctor and you're talking with your client to the doctor, that you know exactly who the doctor is, what is their position, what's the information. Why? Because it's important if you're talking to a specialist that you have that information. Sometimes people will say or promise things verbally. Oh, I'll help you with that. Well, write it down. Maybe they were lying to you. Maybe they can't help you with that. But it's good to know. It's good to know. Keep a file of written responses and other documents. I mentioned how my son Peter is autistic, and my wife has been advocating for him actually for years and years, all the way through school, all the way, elementary school, high school. She kept everything. And when he graduated from college, she had a pile like this. Like I'm saying, literally, it was like this. It was massive, and she kept it all. Why did she keep it all? Because she knew that if they were to say, "Oh, has Peter ever been tested for such and such?" She had it. She'd say, yeah, right here. She did, yeah, in grade 12 he was, and in grade 7 he was, and in grade 3 he was. Here's the results, yeah. Sometimes people will say or promise things verbally as they do not. Yeah, that's right. Keep a file of written responses, yes. Write down your questions. If your client your client becomes upset to talk, you can hand the written list over to the doctor and just say, please, these are our questions. You can do that. Always be, as I say, polite, straightforward, but sometimes we do that. Will the certificate of attendance be issued? Yeah. That's Kathy's situation. Bring the information along with the list of questions. Okay, we move on. Call the office to see if the doctor's on time with his or her appointments. I don't know if you can actually do that, because sometimes the doctors, you get, say you have an appointment for 2 in the afternoon and everything seems fine and dandy at 11, and then suddenly the doctor gets called in on something. Yeah, so they tell you everything's fine at 11, you show up at 1:30 for your 2 o'clock appointment, it's going to be a delay. So yeah, it's good to call ahead of time and talk to the receptionist. You have to be patient when you go to a doctor, I think. That's just sort of the reality. Bring a bottle of water, a magazine, etc., something to read if there's an unexpected delay. I know there's never been a delay when you see a doctor. It's never happened before. It's just like, Air Canada. They've never been late before. Bring a list of medicines he or she uses, put them in a bag or take them with you. It's important to have them with you. We need to know. I think that, and I think it's a clear reality that there's a lot of people who have interactions with their medications, and it's important to know. We move on. Sometimes it's good to talk to a pharmacist about that. I've said that many times. Pharmacists are better sometimes at recognizing issues with medications than the doctor would be, not because the doctor's not smart or the doctor doesn't understand or things like that, because the pharmacist, this is what they do all the time. They deal with medications all the time, okay? Be on time for your appointments. Be a little bit early, actually. Introduce yourself to the doctors and nurses, or new doctors or new nurses. Respect your client's privacy. Remember, you're only there for them. Go to the waiting room if the person requires a physical examination. If they don't want you there, that's fine, okay? Let the doctor know if your client has any hearing or vision problems, okay? It's very important that we know how to communicate effectively so your client is properly being taken care of. Be aware of your body language. Sit up straight, look at the doctor in the eye. So if the doctor's talking to you and you're only ever looking down, it doesn't work very well. Be kind even if the doctor is not. Even if the doctor or nurse practitioner are not, be kind. Take notes. Remember, the notes are not your notes, the notes you're taking for your person that you're advocating for. If you feel upset, take a deep breath, count to 10 before expressing yourself. This will calm you down. It's always good to be calm. Listen, do not move on to your next thought or retort before the doctor's finished speaking. So listen, be patient, respond at the right time. And wait till they're finished and ask questions or bring up your concerns at the end. Do not be intimidated just because the doctor wears a white jacket. No, don't be intimidated. They're a healthcare professional, you're the advocate. If your client wants to speak when the doctor asks you a question, turn towards him and her and suggest that he or she answer. Especially, you should always do that anyway. You know what's interesting about someone with a disability, though? You'll find that if you're advocating for someone with a disability, that doctors, nurse practitioners, or just people in general will often act like the person you're advocating for is not fully capable of consenting or understanding, even though they might be fully capable of understanding. Just because they have a disability, they're often seen that way. And it's good to know that ahead of time, okay? Or if someone's very elderly, sometimes they're not treated with the respect that they deserve, okay? Because they're, let the doctor know if any changes to your client's health happened since last visit. Keep the discussion focused on problem solving. So be positive, keep it on problem solving. If there's a health condition, how serious is the condition? Ask the question, right? How serious is the condition? How will it impact your client's daily life? It's an important question, isn't it? Is it chronic? Will it worsen over time? Will it go away with treatment? What causes the condition? What are the signs and symptoms to watch for? Is it contagious? But also ask for information from the doctor. I know Dr. Google's got lots of information, but the doctor also has information, lots of information. Don't be embarrassed about asking questions. Now, of course, it means that your person you're representing knows you're going to ask questions, but that's fine. Ask questions to make sure you understand the doctor's instructions and explanations. Repeat in your own words what the doctor said, just to make sure you understand and that your client understands. So just be very clear about these things, right? And we move on. How effective is this treatment? It's very interesting because a friend of mine has a type of a cancer that's, it won't go away. It's not going to go away. But he's on this new treatment, so now it's become like a chronic condition. He's not dying, even though he's got a condition and he's considered stage 4. He's considered terminal, but he's not dying. Everything's sort of stable right now. So how effective is this treatment? Well, when he agreed to be part of this experimental treatment, they weren't sure. They were saying, it looks like it's going to be very promising, but there's nothing else we could do for you, so let's try this. And it's working well. Anyway, how will the medications that your client is currently taking interact? It's important. How will this interact in the body? How is the medication taken? How long will your client need to take it? Are they going to need to take this medication for the rest of their life? How much is it going to cost? Well, most things, it depends on their age, how much it costs too. Does your client's insurance, provincial or private, cover the cost? What are the side effects? Will this affect your client's ability to function independently? Like somebody's medication might make them very tired all the time. It might make them incapable. It might make them might make them so they really shouldn't be driving anymore. How long will it take for the medication to work? Are there any alternative treatments? What if they decide not to take the medication? Read up on new medications that the doctor prescribes. Read up on it. Find out about it. You're advocating for them. Maybe ask the pharmacists, etc., about it, and we move on. What tests do you recommend? Tests are important. They do lots of tests. How accurate is the test? When and how will the client get the results? What happens then? I've got a friend who's got he's got cancer, and there's another friend with cancer. I'm in my mid-50s. I've got friends who have cancer. I think that's just how it sort of is. Anyway, this friend, the doctors told him that he thinks it's spread pretty much in lots of parts of his body, and he's got just a little over a week ago, he had this sort of full body scan because they're trying to see where all the cancer went. He's not got the results yet, but you can see how upsetting it would be. But nonetheless, these are the realities. How will the client get results? What happens then? We move on. Questions. Ask the doctor whether he or she has any recommendation based on lifestyle factors, including diet, stress management, and exercise. I don't know if I can do more exercise, actually. I'm a long distance runner. I don't think I can do more. I was going to go this morning and it was raining, so I missed out this morning. But anyway, inquire about services that may be offered that may be beneficial to the person, a dietitian, Meals on Wheels, outings, etc. The doctor may be able to refer you to a counselor, a community agency for help. I'll write down all the instructions given by the doctor and give him or her and have him or her review it before you leave the office. So you want to be accurate. You want it to be very accurate. Do not have your client sign any consent form until he or she understands it completely. Right? And the doctor's answered all the questions. Maybe the doctor's busy or the nurse practitioner are busy and you say, but we don't understand this yet. Let's please, we just want to know exactly what we're signing. Okay, ask for information sheets. The doctors have information sheets. They have lots of them, okay? Ask when your client should next contact the doctor or how if they, the health condition monitored and the progress to get results, determine to determine the treatment is working. So if the doctor says, I want to see you in 3 weeks, then you help them to actually set that appointment for the next 3 weeks. Ask the doctor to do a full medication review at least once a year. This is to ensure that the medications are working well together, being taken at the right times and in the right combination. Some people have reactions to certain things that other people don't have reactions to. It's important to know. We move on. Make follow-up appointments right away if necessary. Help your client fill any prescriptions and ask the pharmacist for information on side effects. The pharmacist will often know. Discuss with your client how the meeting and visit went went. If the client said, oh, you talk too much, it's good to know you talk too much. Was the visit a good experience? What could I have done to make it better? These are important things. You discuss these things ahead of time with your client because you want to be an effective advocate for them. Did I advocate? Did I ask too many questions? Did I ask too few questions? Did I let my clients speak for themselves? It's very important. Did they feel they had enough time to ask the doctor questions? Remember, successful interaction with the healthcare system requires persistence. It requires also patience. The healthcare system can be very challenging to navigate. There are lots of regulations that can impact your access to care, and they can be confusing. Sometimes your technique will not work the first time. Fair enough. You need to keep at it. When accessing certain services, you need to speak up, okay? We need to speak up. We need to be patient. We need to be kind, but we need to be straightforward. There is also an interesting dynamic with older adults when it comes to healthcare. They often say they do not want to bother their doctor, or they do not want to, or they want to be a good patient. Good patient means I'm not going to bug my doctor, right? We have to help them understand that being a good patient or a good advocate for someone else means getting what you need to make sure you have good quality of life. Getting what you need is very important. Some people say, "Oh, I don't." What they're saying is they don't want to be bothering someone. I'll let Kathy handle this.
Thanks, Alex. So regarding doctor's appointments, the coronavirus and other infectious diseases. So with Corona now in COVID and everything else, there's still certain dynamics that come out and play out with doctors' offices. So just be aware of that a visit to any doctors can be different during, this period. And here's some things to expect. They might they might themselves wear personal protective equipment like masks and or gloves, and the staff as well. Offices are always disinfected and sanitized regularly. They're set up for social distancing, but now it seems that more things have opened up, so people are able to, come in and bring their partners or their, an advocate to their appointments, especially now. So you may want to check in by phone. If that's the case, if there's some kind of occurrence that happens, but just waiting and finding out if they're fine to have everyone receive everyone in the clinic as normal would be good. Sometimes they used to have people wait in their cars instead of the waiting room, and only, have one patient in the office at a time. You may also have or be asked certain questions based on the possible contact with people or people who might be sick. You may be asked if you're still sick or were sick recently, and some places may ask you to wear a mask. If you wanted to limit your risk of getting sick, you can keep your hands clean, keep your hands away from your face, wash your hands often, and take preventive measures. Obviously, whatever you find you need. If you need to wear a mask, definitely feel free to. But just keeping this in mind for any occurrences that may come in the next near future. Also, when you're speaking or advocating at the hospital, visiting and monitoring care centers, as an advocate, you may find yourself advocating for someone who is in the hospital. Your primary role may be to visit the person in the hospital, and you just want to keep in mind to observe anything that may be happening and advocate for what they would like based on prior discussions. So again, if a person needs to have certain things in place for their well-being, you want to maybe just remind them that, oh, I noticed that, your sheets are not being changed as often. Is that something you want this to still remain the same, or did you want certain other changes to that? And just ask them those questions. Things, how are your basic underlying medical conditions? Are they being acknowledged here? Are you, advocating for yourself to make sure that you get the same medications you used to have that were working for you? Sometimes when people are admitted to a hospital with an emergency, they forgo kind of what the original routines are when it comes to their care or their, for example, blood pressure medications, or if they have a heart condition or if they have respiratory conditions. And that's a bigger issue, because then you start to actually allow your underlying conditions to override whatever other additional symptoms you have, and they're not being monitored. So you want to encourage and remind people of that. We recently had this situation where a person was admitted to hospital because they had an infection on their foot, and then sadly, their other conditions, like, for example, diabetes, were being overlooked and they were not being medicated properly. So of course their blood sugar will go up. So that's something you want to keep in mind, right? You may need to inform a family member or their decision maker, if they have one, about a situation or treatment that you've observed. So again, if insulin is not being delivered, if meals are not properly administered and they're not actually being given to the patient, if the patient has dementia, not able to feed themselves, or if they're delusional or not quite aware or cognizant of feeding themselves, then that's another neglect potentially that's happening. You want to maybe respond to that and ensure that person is being advocated for properly, and that you can follow through on that as well, or having their family help follow through on that. And in many cases, the person you're advocating for will be fully aware and may not need you to speak on their behalf. However, your presence should improve the psychological well-being of the patient and may speed up their recovery. So just knowing you're there makes a big impact, and it has a huge influence. Also, it shows the care and the staff there that they have someone in their camp. They have someone rallying behind them. There is community surrounding this individual. They're not going to be neglected. And, someone is looking, watching, and aware of what's happening. In addition, being there may result in better healthcare, obviously, and that's the point there that's made. And so when you're at the hospital, you want to visit as often as possible. We just found out this other lady we know from a community perspective has been admitted to hospital, has been there for 2 weeks. I didn't know she was there for 2 weeks. So as I found that out yesterday, I know, and I'm making cognizant this to other people in my group, in our community, our circle, because they may want to see her. We're not sure how dire her situation is, but the problem is, you don't know when you have that time, and when that time may be growing shorter. So we want to ensure that people know about her situation. I myself am going to make an effort to go and visit her soon, this week actually. So you want to monitor the medication as well. So if there is any difficulty in administering medications like food, hydration, nutrition, look at other options. Speak to Alex, myself, call our line. If you don't know how, there are other ways that could be remedies for the person to administer hydration or food, nutrition, whatever it is, medication, proper protocols, definitely be made aware of that. If that's particular to that person, they need to have that examined, because these are things that kind of get slipped through the cracks, and then there's issues that can arise from it. Taking notes on the medication that they're being given to make sure that it is the correct drug and the correct dose. So again, so important. Alex mentioned this too. Medications seem to be on the rise, and there seems to be a layering of different medications, but there's also contraindications and, contramedications that will affect one another. So if you take, blood pressure medication and they take that off abruptly, you can have higher blood pressure, and that can affect your kidneys, your electrolyte levels, your sodium levels, all of those things, right? And that's an issue too that may give rise to. Make sure that the dosages are correct, given at the right time. Do they have to eat before they take a medication or on an empty stomach, right? Check that your client is getting the right levels. They should not be in pain or over-medicated, and they should be cognizant. They should be aware. They should be lucid. They should not be, not aware of what's happening, and be able to comprehend this. Inform hospital staff of any special needs of your client. So if they have dietary restrictions, please let them know this, because some people don't remember these things when they're admitted, and their care team may not be aware of it. Make your client more comfortable. If permitted, please bring a skin moisturizer, lip balm, personal item, blankets, items that person that they will appreciate, a family photo, or a favorite book or magazine. And throughout their stay, you may wish to read aloud a favorite book to them, or saying something, or, maybe if they're spiritual, you may want to, speak to them about that, or pray even, for example. Studies found that the median rate of medication error or unintentional medication discrepancy was nearly 50% in adult and elderly patients after hospital discharge. So this is a critical factor, and we want to address this to you. And this came out in our analysis of this. Nearly 20% of adult and elderly patients in studies were reported to be affected by adverse drug effects, ADEs, after hospital discharge. So after discharge happens and they leave the hospital, that's when issues can arise just based on medication errors and unintentional discrepancies. So make sure you understand how the medication is supposed to be given, the regimen, if it's different from the client's pre-hospitalization, if there's actually change that's been made. Let's say they were given a new medication. Are there any possible adverse effects ensuing? Are they losing feeling? Are they noticing they're being numb? Do they have trouble walking, sleeping? Are they restless, breathless? These are issues. These are things that you want to bring up and be concerned about if they actually arise after medication is given. And after they leave the hospital, why are there changes being made? So this is really important. Again, when a person has, for example, dementia, this is another event that may happen, that a dementia will happen if a person is, as time goes on, it becomes worse. So they start with perhaps forgetting certain things, events, people, places, but then it becomes gradually worse. And so being, for example, an individual who has dementia, being in an unfamiliar hospital environment can be disorienting and confusing. Hospitals can be very noisy and are full of unfamiliar people, bright lights, reflective surfaces. So your client, your person that you're visiting may not feel well, and he or she will be touched and questioned by medical staff. So it's important that you're kind of there as a support person to guide them around and along that path and journey. Someone with dementia may often or cannot or will not accurately report symptoms or pain. Again, this is another important point just to make and mention. They may not remember what happened or what they need to be, why they are in the hospital. This can cause agitation, delirium, aggression, worsening of symptoms, and other challenging behaviors. Hospital stays can bring out these behaviors. So it's very important to keep these in mind. Also, there are certain, as an advocate, you can help relieve these stressors. For example, ask if harsh lighting can be dimmed. You have that ability. It's easy to remedy. Also, you can ask to be moved to a quieter area. If you notice that there's a bit of a jungle happening in one section of the hospital ward, then you can start and ask if it's possible to be moved, and be present when they move that person if you're able to, because you'll help calm that individual. You can bring a simple calming activity for your client to focus on and help them stay busy while they wait for treatments or tests. Also, you can take notes. If you notice expressions of pain or changes in their symptoms, you can update the doctors and nurses. Delirium is something that we want to mention here because it happens suddenly and typically changes throughout the day. Sometimes people will call out for help. They'll call out their parent that may be deceased even. Some situations may arise. If an older adult with no history of cognitive impairment suddenly starts having cognitive issues during or after hospitalization, it is most likely not dementia. It may be delirium. People with delirium will often have terrifying hallucinations, delusions. They may be unable to think or speak clearly or focus. And also in older hospital patients, these symptoms can be misdiagnosed as dementia. Some patients with delirium are agitated and combative, and others are sleepy and cannot pay attention. They may show symptoms of post-traumatic stress disorder. It can happen at any age, but delirium is more common in people who are aged 65 and older. And research has linked delirium to longer hospital stays, greater risk of falls, increased risk of developing dementia, and increased death rate. So it's important to keep that in mind. And it's important also to, it's more likely to develop when there's large doses of anti-anxiety drugs and narcotics. So again, things like tranquilizers that treat anxiety called benzodiazepines are known to exacerbate the problem. If you want a list of certain medication types that have these, you can look them up online, or you can email us and we can find out if these are something that could be affecting that as a tranquilizer. Patients are either in intensive care, so when they're admitted to ICUs, this can happen then as well, because it's when new doses are given, perhaps. Patients are often heavily sedated. And this is what will often start this, and delirium will happen out of the blue. And the environment is, the patient is on a ventilator, and the environment is busy, noisy, and brightly lit. So that can also spur it as well. Sleep is constantly interrupted and the staff keeps changing. So some warning signs to keep in mind and be aware of are that there could be acute changes in concentration. They have inattention, they have a disordered thinking speech. We've had individuals who kind of feel like they're mumbling, they can't organize their thoughts. We have excessive drowsiness, disorientation that can happen, inappropriate behavior, like again, calling out alarming signs, unexplained difficulty with feeding oneself, and unexplained difficulty with mobility or movement of the person if they're immobile. What are some things you can do? You can speak to the doctor to minimize the amount of medication. If you notice negative side effects, ask them to make changes immediately. Now, this is something you got to call on right off the bat. Okay, you don't want to wait a couple days because this can get really quickly worse and problematic. You want to ask the staff to dim the lights. Maybe that's the cause of it. And you can turn down noisy machines if possible. Close the door, reduce noise, keep your client hydrated. Water is so important for elderly persons, especially because medications dosages are affected so much because of this. And also you want to stay with your client so they have a familiar face. They don't feel alone or, abandoned. Also, arrange for your client to get a maximum amount of undisturbed sleep. So for example, ask doctors and nurses if this can be coordinated and controlled to be less frequent and without harm to the patient, obviously, at times that are convenient to them too. Have a large print clock and a calendar visible so your client can see the time and date. So they're not as, uncognizant of what's happening. Bring a family photo so they have familiar faces to look at. People want to see that. Whenever possible, ask your client to take short walks or practice therapy exercises. You can just go around the block and even around the hall, around the world, like where they are in their world there with them. And that will help them, of course, because that will help with them knowing that you're there. Delirium, in a study by Harvard researchers found that a variety of non-drug interventions, making sure that the patient's sleep-wake cycles were preserved, that they had their eyeglasses and hearing aids, and that they were not dehydrated, reduced delirium by 53%. As a result, falls among the hospitalized patients was reduced by 62%. So this is part of our questionnaire. It's in the program training, which I posted in the chat, and I can email it to you as well. So as we kind of come to a close on these points and these topics, I know we covered a lot of information. As I said, we can send you the book. If you need a hard copy, just let me know. All the materials are made available to you because we care for you to have these. We don't want there to be an obstacle, especially for you to have this and be able to go out and visit and be an advocate for others. Some suggestions for patient advocates is that we encourage you to start a support group. We host, thank you. Alex is showing you. There's a patient advocacy pamphlet that we call a handout. It's a very short handout, and you can use that and keep that close to you when you are visiting, and you can order it from us too. And also, we want to make sure that you're supported. So we actually host an online support session once a year, but we can create a higher frequency to that as well if you need it, or if you just want a speaking opportunity to talk to someone. There's ways we can support you, Alex, myself, and our team. There's something to bring up here too, burnout, which, if you're visiting too often, or if you're feeling that you're being called too often on certain advocate, situations, and there's an issue that's happening or unfolding with your situation or the person that you're advocating for, please feel free to reach out to us. There's ways to kind of circumvent that. You can bring in a second person who's had the training. You can bring in a partner that is trusted to you and the person, the patient, so that you don't feel like the stress is on only you. And you can also find some care. If it is a person who happens to be in hospice or elderly, and there's someone that's in their community that wants to participate in this training, you can start to share that opportunity with them as well. And we encourage you to share this with us. If you are finding you're burning out or there's issues that are coming up, please let us know so we can help you and remedy that. Also, we encourage you to keep a journal. It's really simple. Bring a notepad, paper, and just keep a journal of your accounts of what happens. It's really important to be detailed around this. We want to also encourage you to evaluate your appointments. So if you have, for example, an event that happens and you want to follow up on it, then this is a good opportunity to make sure that you are keeping accountability to yourself and the patient that you're visiting. Think of opportunities for enrichment. Whenever you're meeting with someone, it's important to keep in touch and also keep on top of getting them stimulated and happy, and also be creative in your solutions. If you have a concern, obviously, please speak to your client. If you want an extension of support from myself, Alex, any of us, feel free to reach us on the helpline. It's a 1-855 number. That's 24/7. If you have a question, you've come across, you need some support, please let us know. You can reach us anytime on that phone number. Also, you could call during office hours, which is our office number here. And that's, the helpline is confidential. It's absolutely free. And so we encourage you to keep in touch with us, and it's important to be here. So thank you so much for all of you to join us tonight. We hope you do and stay in touch. I'm sure Alex would like to share with you also a couple mentions at the end, but just briefly, I want to say Compassionate Community Care exists thanks to the generosity of our donors. So although this is free and the materials are free, we do encourage, if you're able to, please feel free to send us a donation if you like, or support us in any capacity. You can mail it in for a check, or you can do it online as well on our website under donations. And we are a charity, so we issue tax receipts for all donations. So we definitely appreciate your support. Thank you so much. And I'll ask if anyone has any questions as well. And Alex, if you want to mention.
I was just going to reiterate that the fact is that everything is done free by Compassionate Community Care because there are donors. So if people don't donate, then obviously there is no Compassionate Community Care. I was going to also reiterate the fact of the note taking. I know we've said this before, but everything in that is the person who you're advocating for. It's their notes. You're taking them, but it's their notes. They have nothing to do with you. So therefore, they're shared with no one. And it's very important that the privacy is primary on all that.